Welcome to Contemporary Retirement. Contemporary Retirement is a public interest program focused on the retirement community. Every program has segments on legal, financial, and health issues affecting the retirement community. Contemporary Retirement is sponsored in part by a major grant from the Family Heritage Trust Company.
Contemporary Retirement is sponsored by Family Heritage Trust Company. The Family Heritage Trust Company is an independent bank chartered trust company established by local professionals to provide fiduciary services including fee-based investment advice, trust services, retirement planning, and tax planning. The Family Heritage Trust Company is committed to client service in our communities. For more information, call the Family Heritage Trust Company at 301-631-5900.
Contemporary Retirement is sponsored in part by a grant from R. Thomas Murphy & Associates, P.C. R. Thomas Murphy & Associates is one of Franklin County's leading law firms, emphasizing estate, trust, elder law, and medical assistance planning.
Welcome to the Is It Legal feature on Contemporary Retirement. Is It Legal focuses on the legal issues affecting the retirement community. With me today is Tom Murphy from the R. Thomas Murphy Law Firm with offices in Waynesboro, Chambersburg, and McConnellsburg. Welcome to the show, Tom.
Good morning, Mike.
Tom, we've been doing a segment on This Means You. What does that mean?
Well, we're trying to spread the word that if you have these documents and they have the problems we're talking about, you need to fix it or else you put yourself in jeopardy.
Well, when we say this means you, as I remarked a couple of weeks ago, I had a client in my office that watches this show regularly, had a 1988 power of attorney, and I marveled that they were not getting the message. We've been saying here for the last 8 years on Maryland powers of attorney, if it's pre-2010, it needs to be redone. This means you.
Exactly, and it's, we're not trying to drum up business, we're trying to protect our viewing audience and our clients, and if you do these simple things, it has great power.
And then we have another problem, and that people like their own lawyers, and listen, we respect that. Yeah. And one of the things that we don't do is we don't do divorces, we don't do adoptions, we don't traipse into the normal law practice. Mm-hmm. So when people come to see us, we're really hired guns to deal with one very specific issue. And I routinely tell clients, you have a fine lawyer. You don't need me except for this one piece of your life.
Exactly. Everything's become much more sophisticated, complicated, and specialized. And so, for your general lawyer, that's probably a good fit. But when you have a nursing home issue, something along those lines, you need to get specific, real information.
And of course our challenge is as lawyers, CPAs, financial planners, all of whom have been to a seminar that heard that it's illegal to transfer assets within some period of time ago in a nursing home, which is just absolutely not true.
Exactly. A big part of our practice is just educating people and re-educating because they've been fed this stuff from a variety of sources, so they're thinking they can't do anything, and it leads to many people spending money that they shouldn't be spending.
Well, going back to This Means You, we deal with the fact that we're dealing with older folks who need to use that power of attorney all the time. And in fact, we see people that will put just a single name on that power of attorney. Well, the reality is that many times with women, they have flip-flop between their maiden name and their birth certificate middle name. And if you have a power of attorney that has one name or the other on it, it may be almost impossible to use it for the alternative name.
Well, that's a good point, because again, they've used different names for different accounts and all kinds of stuff. And so it's critical that you make it consistent, even if you've got many aliases and whatever you want to call yourself. Let's compile that in one document so you can do business.
So if the woman's maiden name was Smith and on her birth certificate was Jean, we put Betty Jean as well as Betty Smith, so we have both ways, so that if something shows up one way or the other, we're good.
Absolutely, and it's very simple. It's a couple pen strokes and you fix it.
And then we have these late in life marriages. So Betty Smith is now married Mr. Jones. So we'll also have formerly known as Betty Jean Smith, now known as Betty Jones.
Right, and it's everywhere. Pieces of real estate, bank accounts. You need to consolidate that so you can do business.
And the federal government routinely uses women's maiden names as their middle name, even when they don't.
Exactly. So you have a real disconnect and a problem out there.
And we have financial institutions that are resistant to powers of attorney to begin with, and then you don't have a name that matches, you have just increased your difficulty level.
Exactly. It's almost as you're going through an inquisition and they're trying to zap you, and they will, because they don't want to have to honor these things.
And then we have another problem, and that's junior. Now, senior is not on the gentleman's birth certificate, but junior is.
Exactly.
And so we have people, well, my dad's gone, I'm no longer junior. Well, did the magic ink disappear on your birth certificate? No, it's junior. And so if they're an older person, they may have sequence where they used junior while their dad was alive, but didn't use junior after their dad died. And so we got to pick up that power of attorney both with the juniors and without the juniors.
Exactly. And all those things, those details are really critical for the success of the document and for the ease of administration.
Well, one of the problems is that because we're dealing with this all the time, we see the traps. And so, you know, one of our roles as elder law attorneys is to anticipate the traps and try to make sure that we're prepared for them.
Exactly. And so there's a variety of ways we can do that to adjust. And life's not always easy, but we can try to smooth out those bumps.
And you have to deal in the framework that it doesn't matter that your local bank might not give you any difficulty on that power of attorney, particularly if mom went down there with you and you presented it with her there, because now they don't care. But on the other hand, if mom is incapacitated and now you're trying to use that power of attorney with a money center financial institution, it's almost guaranteed that if you don't have the right form, you're going to have a problem.
Yeah, and we see a wave of that every time there's a buyout. You get these problems, resurfacing, and so the people you thought you knew and trusted now are being told by corporate that they got to do this and that. So it's a never-ending game.
Well, and I think you just hit on something. It's rarely evil intent on the part of the local branch manager. It's their new bosses that have now, driven down a new gauntlet that you have to go through. And the fact of the matter is, you have to anticipate that's going to occur.
All right. I mean, it's just that's the way of the world. These buyouts, things changes. Just keep up with it, and you'll be fine.
Tom, as always, thanks for taking time to appear on the program.
You're welcome.
More from Contemporary Retirement after these messages.
Few things in life are as important as family. Leave your insurance worries to us, Wright Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
Every life that meets its end leaves a heart for love to mend. Sister, brother, family, friends are left to carry on. When the loss seems more than you can bear, it's nice to know that we'll be there at Double Save Fiery Funeral Home. We care.
Call Ed Lowe to help put your mind at ease.
Welcome to a special guest feature on Contemporary Retirement. This segment focuses on various issues which are of importance to the retirement community. With me today is Beverly Stambaugh, Executive Director of the Red Cross in Washington County and adjoining areas. Welcome to the show, Beverly.
Thank you very much for having me.
Beverly, this has been a very eventful last 3 or 4 months for the Red Cross.
It really has. We've got 3 large disaster operations in progress, and it's really tapping our resources, but we're doing all we can to make sure that we're providing relief for those affected by these huge storms that have come through.
And so your organization is really has the ability to mobilize and provide assistance on a scale that most people have really no idea.
Absolutely. At one of the points during all of these disasters, we currently had over 13,000 volunteers on the ground working, assisting those individuals in need. We served over 1 million meals. I can't even tell you how many millions of snacks and such have been provided. And 91% of those workers that are on the ground are volunteers. These are a lot of individuals who are already trained and in our system. However, we had a huge influx of individuals wanting to respond, as we call them, event-based volunteers, that they see the devastation and say, I want to help, and they contact us. And we kind of give them some quick boot training, get ready training, and we send them off. And they actually go for a full 2-week deployment, which is a lot to give up. Now they're sacrificing their home and their families and their time to help our fellow citizens in need.
And unlike first responders, the Red Cross is determined to keep their volunteers safe. So you're not in the middle of this stuff, but on the immediate periphery providing support.
Absolutely. We like to try to provide immediate comfort to alleviate the human suffering. However, it is very important that our volunteers who are out there working are not put in harm's way or become clients themselves. So we do really take that as a paramount, that when we're sending anybody out, that it's safe. I myself was actually deployed to South Carolina pre-Irma landfall, and I was a little concerned about my well-being. I'm like, you're putting me in the middle of an eye of a hurricane. But it was very safe. They don't send you out unless they know that they have a safe place and a shelter for you to be in, to be able to respond after the fact. But yes, that is very key, that not just our staff and our shelter workers and our volunteers, but everyone. We really want to make sure everyone stays safe.
And we just mentioned two elements there. The first element is the people who have been engaged in the system for a while, that are trained to deliver various types of support services, whatever their skill set allows them to do.
Correct, yes. So we do have a large number of volunteers that have been in our system for a long time, which we're very grateful for. Those are the ones that respond right away, that have the training and ready to go. When we put the...
So they might have this set up a field kitchen or other support
Exactly.
services.
They could be shelter workers, shelter managers, case workers, people who've gone through our training and know how to actually perform those duties on the ground in the affected areas.
But in the meantime, those people also need gophers, so you might actually send somebody down there that's really just to be labor.
Absolutely. There's so many different positions that are needed on a relief effort, including, as you call, a gopher, someone who can just be the one to run back and forth to get some more supplies, pick something up. But we really want to make sure that when we operate our shelters, we have trained individuals in there who know what our procedures are and how to best protect our clients and protect their security and their safety.
And of course, that brings one of the drivers of the Red Cross. It is primarily volunteer, and so we need people to both, respond to the big stuff, but also be available on a routine basis within our community.
Absolutely. We're always in need of more volunteers. I know that sounds probably a little tiresome to hear. However, there are everyday occurrences that happen right here in Washington County and across the 5 counties of Western Maryland. We need people to respond to fires to help those clients that have been affected. And we have a few that work in those positions. We could call them our disaster action team volunteers. And they basically go out and help a family after a fire. And if we have a couple fires in 1 week and we only have a small pool of volunteers, they get a little tired and may not be willing to respond, understandably so, because they're a little tired. So to have a nice base and pool of volunteers to call on is exceptionally helpful, because it speeds up our response effort and our time. We like to be at a fire within 30 minutes of being dispatched so that we can get to those clients in need and provide that assistance.
But somebody might be watching this, so that's all well and good, but I'm not trained as a first responder. But in reality, you're looking for volunteers even within the local chapter for a multitude of tasks. No great skill sets required.
No, and there's no great skill set required for someone responding to a fire either. We train you, but basically you're there providing one of your fellow citizens, neighbors, comfort, some additional cash to help get them through the evening, and some resources to help them get back on their feet. There's so many other positions. We need assistance in our office. We need people to help actually receive calls from individuals overseas. We have lots of different opportunities for people to help out. So if you're not someone that wants to go out or leave your home, we have a lot of work that can be done right from your home.
Beverly, I want to thank you for taking time to appear on this show.
Thank you very much for having me. And if anyone is interested in joining 1-800-RED-CROSS or redcross.org.
Thanks.
You're very welcome.
More from Contemporary Retirement after these messages.
Tranquility at Fredericktown Assisted Living and Memory Care provides a warm, home-like atmosphere that promotes daily life enrichment. At Tranquility, our medical director is a geriatric physician. Our professionals support and understand the various stages associated with Alzheimer's and dementia. We have on-site physical, occupational, and speech therapists, as well as around-the-clock licensed nurses. For more information, give Tranquility at Fredericktown a call today, because everyone deserves great care. Let us do the caregiving so you and your loved one can embrace life again.
Dad, there's the big one. There's the big one. Just wait.
There's the monster.
Just one more bid on hurleyauctions.com.
I got it.
If you haven't visited hurleyauctions.com, you don't know what you're missing. Whether you're buying or selling, antique cars, tractors, boats, or real estate, you can do it all at HurleyAuctions.com.
Get to know Dr. Carrie Hesley at Diagnostic Imaging Services.
What I find most rewarding is caring for women through our Women's Imaging Center. We have a caring staff that will ease patients through an ultrasound, bone densitometry, breast biopsy, or mammogram. Our health team is sensitive to emotions involved in women's imaging and understands that every woman is at risk for breast cancer. Providing the community with a center that is so dedicated to breast health and the imaging needs of women is something special.
DIS Women's Imaging Center, providing women with progressive care.
Welcome to Contemporary Health Scene. Contemporary Health Scene focuses on the health issues affecting the retirement community. With me today is Dr. Shawn Weigel, ophthalmologist, Ludwick Eye Center. Welcome to the show, Dr. Weigel.
Thank you for having me.
Glad to have you here because obviously among the retirement community as people age, eye issues are very common.
Very true, yeah. Everybody has problems as they grow older with just general vision, you know.
Well, you know, I've heard you say that basically cataracts, sooner or later, if you live long enough, everybody's going to get them.
That's very true, yeah. Everybody gets them. It may affect them differently, but certainly everyone has a cataract present.
So what is a cataract?
A cataract is a lens of the eye that gets opacified with time, typically causing visual problems. So,
all right, so it loses clarity then?
Clarity, blurry vision, those kind of things that you notice as we just kind of assume there is an aging process of the eye, but it can really affect people's lives, you know, in many ways.
So genetics are not necessarily a factor in developing cataracts then?
Not entirely in an aging cataract, that's true. It's not by itself.
Of course, then there are other eye afflictions that you also deal with as well?
Things like macular degeneration, glaucoma, diabetic retinopathy, yeah, just to name a few. There's a lot of them out there.
And you know, the treatments have improved dramatically over the last 20 years for all of these afflictions, not necessarily curable, but perhaps slowing the deterioration.
Management of ocular disease is very important, and getting in to see somebody as, you know, an ophthalmologist is an important step in helping that. Yes, that's true.
All right, we're going to bring up some slides here that sort of illustrate what we're talking about. So as you were talking to someone, how much you explain this slide?
Well, the three pictures that show, you know, a cloudy vision on the right side, which may be, you know, from a cataract. It could be other ocular disease, but those are main problems that you see: blurred vision, color changes, and things like that.
All right, so what do we have here? A healthy eye and then an eye with a cataract.
On the left side, there's a clear lens, and then you see on the right side where it points to cataract, that's a clouding of that lens.
Oh, this is a pretty impressive piece of equipment. What does it do?
This is a femtosecond laser, not to get too technical, but what it means is it's essentially a laser that helps us to soften the cataract, treat astigmatism, and create incisions, really adjusting for, you know, improvements in outcomes.
Now we have a picture here I know you like to talk about. Tell me why.
Well, in this picture on the left, you can see how the blues aren't so blue and the greens aren't so green, and even looking at the leaves on the tree are not quite as sharp and detailed.
All right, you have three offices. Where are they?
We have one in Chambersburg, one in Waynesboro, and of course one in Hagerstown.
And the fact is that you encourage people that as, you know, they begin to see an ophthalmologist. You know, it's one thing, you know, as a younger person, you know, going and getting your eye, you know, glasses and so forth is an issue. But as you age, and if you notice any deterioration, it's really a call to action.
It's important. The American Academy of Ophthalmology recommends people over the age of 50 have an annual eye exam to pick up on things like cataract, macular degeneration, glaucoma, just to name a few.
And particularly with those that have a deterioration over time, then it becomes very important that you get on top of it as soon as possible to try to reduce the negative impact.
Absolutely. They've shown, there's been studies that have shown that people who have their cataracts removed earlier have less incidents with accidents, whether they be driving and or falls. So there's plenty of information out there that's very helpful.
So it's a safety issue in addition to a quality of life issue.
Absolutely. It can improve people's lives and really make a difference.
And of course we know it's epidemic in this community with diabetes, and so I understand that it's important that you also address people who have diagnosis of diabetes.
Absolutely, yeah. All these aspects come together to give people perfect vision and give them the ability to see in the world in which they live. So they must make sure they have their appointments and come in annually, really, what it comes down to.
And one of the things we encourage people to is not be trapped into preconceived notions as to what this treatment might look like. I can remember when I was a young man that you might actually be in the hospital with sandbags and all kinds of stuff on cataract surgery and using what you might consider basically Stone Age axes compared to what you use today.
We've come a long way. You know, with this laser-assisted cataract surgery, people are having amazing outcomes. It's almost even refractive in nature, which means getting them to see better than they probably have ever seen before. We take some people with very high levels of nearsightedness, and now they can see better than they've ever seen before, which is amazing if you really think about it. We've come a long way.
And of course, many of the significant eye procedures are covered by health insurance, and so people should not be reluctant to come get a consult and find out what their options might be.
Absolutely. I mean, the laser is an additional cost for many people. Most insurances don't cover the laser, but routine or traditional surgery is very effective, and our outcomes are fantastic on both sides.
And people are really quite surprised at how short a time it is, the recovery.
Recovery is very quick. You know, the activities and the limitations were, you know, for weeks before, but now it's just within a few days you recover. People do well.
Dr. Weigel, thank you for taking time to appear on the show once again. Where are those locations?
Chambersburg, Hagerstown, and Waynesboro.
Thank you.
All right, thank you.
More from Contemporary Retirement after these messages.
Albright, Crumbacher, Mal & Idtel are a full-service firm that provides elder care services including managing incoming bills, bill payment, depositing checks, balancing bank statements, and preparing, planning, and filing personal tax returns. Put your mind at ease and call us today.
Welcome to the Making Sense feature on Contemporary Retirement. Making Sense focuses on the financial issues affecting the retirement community. With me today is Christian Wright, President, Wright Gardner Insurance. Welcome to the show, Christian.
Thank you, Michael.
Chris, you know, we spend a lot of time talking about what many people think is very simple, very obvious, and that's homeowners policies. But actually, there's a huge number of traps associated with homeowners policies.
Absolutely. They're not all the same. You need to be careful. We've talked about the exclusionary language in the back. That's where you should really start.
The 40 pages.
The 40 pages, right.
Not always the one page that shows the coverage.
Yeah, right. Those dreaded attorneys, they always put everything in the back in the small print. That's what you need to pay attention to. But in all seriousness, there are definitely vast differences between homeowners policies.
Well, let's just deal with some of the obvious stuff that people don't pay attention to. Number one, you know, you bought that house, you bought it with a bare minimum. It didn't have, you know, all of the upgrades that you wanted because you were out of money. You bought the max house that you could buy. But over the last 15, 20 years, you've lived in that house and the upgrades have begun. Does your insurance agent know that?
No, no. And that's one thing we've talked about many times is the importance of communicating that to your agent so that you can make sure you have enough coverage. Because there's not, it's not going to automatically keep up with things that the insurance carrier doesn't know about.
So, you know, you use basically, we see a lot of carriers, when I actually put a house square footage in there, it comes out around $132 a square foot. But that's for carpet over particle board. That's no hardwood, no chair rails, no crown moldings, no granite, you know, and so on and so forth. So you have that situation in which we hated that carpet. We took that carpet out and we put hardwood down. Now the square footage didn't change, but what did the reconstruction cost of the house happen?
Right, exactly. It went up substantially, again, depending on the type of floor as well. So those are the types of things you definitely need to let your agent know. Some homeowners policies, Michael, they do have some minor inflationary increase, but don't be misled in thinking that that actually keeps up with you actually doing upgrades, adding granite countertops and things like that.
And so the reality of it is that it's not the value of the house that matters, it's the cost of reconstructing it.
Oh, absolutely. And that's another thing we've talked about as well, is people saying, well, my home is tax assessed at X amount. That's not the insurance amount. You know, and we have that discussion all the time because the insurance is designed to replace that structure and the contents within just 1 millisecond before that loss.
And you know, we always pick on your grandfather a little bit, but he owned one of those houses on Prospect Street were just enormously expensive to reconstruct, and yet the value was not substantial.
Exactly, exactly. And we have a lot of homes like that in your viewing area for your viewers. You know, and it doesn't take long for the value per square foot to go well in excess of that standard $130.
Yeah, we see well over $200 a foot for historic reconstruction, and so those numbers are just wrong.
Yeah, and you know, you may have, again, we talked about the crown molding, things like that.
We also see murals, hand-painted murals in homes. Again, chair railing. I mean, everything just kind of adds up.
And the millwork that was in your grandfather's home is just not replaceable almost.
Yeah, I mean, and that's, you know, the fancy homes of the past are beautiful, but to reproduce those today takes a lot of time and a lot of money.
So how about that basement you finished?
Exactly. That's not automatically covered either. I mean, those are the types of things, whenever you make a change to your home, you should tell your insurance agent. I mean, the worst thing that can happen is the insurance agent says, you know, that's not a big deal. But you got to tell them, because if you do finish that basement, again, that definitely will add some value to the home.
How about that detached garage?
Absolutely not. And that's another thing we see all the time. People, again, build that garage and they just assume that it's covered.
Closed in that garage for an in-law suite for mom.
Exactly. Well, and sometimes moms, you know, that's where they should be, but nonetheless, you got to let the agent know for those changes.
How about mom's contents?
Mom's contents would not be covered, yes. So again, we've talked about tenant homeowners policies for aging
If they have any contents that are of any value, they're not covered by that child's policy.
Exactly, exactly. So they should either have their own tenant homeowners policy, and there's some other ways to address them as well.
And then, of course, we have some companies out there that have guaranteed replacement cost policies, but they have a number attached to it, and they're not going past that number without a lawyer.
Exactly, exactly. So you got to be careful if your agent says guaranteed replacement cost no matter what. Ask them to explain it to you exactly how that works, because you could be tripped up in thinking, again, assuming that there's a coverage that you don't have, and you won't know until after a loss, and then by then it's way too late.
And so we tell people every day, the real reason you have that policy is to get your house back. And if you start shortchanging that, you run the risk of not getting your house back. And if you really play a game with the insurance company, there's a chance that you actually can, percentage-wise, lower your coverage.
Oh, absolutely, absolutely. Again, people think, well, I'm going to save on the insurance premium, and quite frankly, you're really cutting off your nose to spite your face. That's not advisable. See what it costs to make sure your home is 100% insured.
Christian, as always, thanks for taking time to appear on the program.
Thank you, Michael.
Thank you from Contemporary Retirement.
Remember a more carefree time? Leave your insurance worries to us, Wright Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
These days, it seems like everything's online, and filling out claim forms and receiving and paying bills online isn't always easiest. That's why we at Quality First Insurance encourage you to just give us a call. Let us help.
Hi there, I'm Paul Sweeney with Quality First Insurance, and it's still just this simple. Our offices are open every weekday where you'll be able to call and speak to real, live people.
No detail was missed. I'm so glad that I turned to Quality First Insurance.
I've recommended Quality First Insurance to my friends who've been just as satisfied.
If you're not happy with what you're paying for Medigap, or more importantly, not happy with your service, give us a try. We're locally owned, and we take the time to provide you with the best. We are Quality First Insurance, and our mission is to provide quality products to quality people. Pick up the phone and give us a call today at 800-745-1411.